Good morning everyone. This is Kavi Priya from SNS College of Allied Health Science, lecturer, Department of Cardiac Technology. I would like to share my case study video about infective endocarditis. Here the bacterial infection is an infection proliferation of harmful strand of bacteria inside the body. So bacteria can infect any area of the body, and examples of bacteria are enterococci, Staphylococcus galloliticus, Cardiobacterium, Homonis. Here the enterococci. Enterococci is a gram-positive cocci. So in non-motile, on sporing, enterococci are a facultative anaerobic organism. They are capable of cellular respiration. Enterococci are most commonly transmitted due to poor hygiene, since it is naturally present in our gastrointestinal tract. And here the case scenario of infective endocarditis. The 10-year-old previously healthy girl presented to the hospital with bacteremia. The patient was initially admitted to the hospital 2 days prior with 3 days of fever, that is up to 40 degrees Celsius, emesis and fatigue that were thought to be related to viral illness, and she was discharged home 24 hours later after a condition slowly improved. A blood culture which was obtained during the hospitalization resulted positive at 48 hours of gram-negative rods. So family was called and the patient was readmitted. The patient had no chronic disease and took no medications. She developed a new regurgitation of heart murmur 2 days after admission. So the transthoracic echocardiogram was obtained due to concern of infective endocarditis, and this showed vegetation on the mitral valve. She had transesophageal echocardiogram and which confirmed 13 into 10 mm of vegetation below the posterior mitral valve leaflet and resulted to be a mild to moderate mitral valve regurgitation. And here the infective endocarditis is also called as infective bacterial endocarditis. The infection is caused by bacteria that enter the bloodstream and settle in the heart lining, heart valve and blood vessels. It is a very serious infection of endocardiogram. See the picture where summarize the infections in aortic valve. And this one is normal aortic valve. And pathogenesis are the valve abnormalities, prosthetic valve or either native valve damage, and thrombi with the fibrin and platelets with bacteremia in blood streams. That bacteria adhere to the thrombi and get proliferated. So endocarditis leads vegetative, and this is infective endocarditis finally. Clinical manifestations are signs and symptoms also noted. Signs are non-specific in splinter hemorrhage, and more specific signs are Janvey lesions and rod spot. Symptoms again fever, chill, abdominal pain, back pain, anorexia, arthalgia are noted. And diagnosis also done, history get collected, physical examination also completed, and complete blood count, that is leukocytes in acute stage. So ECG also done, tachypneic were noted, all the chest leads, and chest X-ray also done, swelling of heart, transthoracic echocardiogram resembles 3.5 mm of vegetative sensitivity and posterior mitral leaflet. And finally, treatment belongs to first initially medical treatment were done, that is acute gentamicin antibiotic or subacute benzyl penicillin was given, and triple therapy with the vancomycin and gentamicin, oral rifampicin. And surgical treatment belongs to removal of all the infected tissue and repair of replacement of infected valve and drainage of abscess and repair of heart tissue, that is removal of all the infected tissue involved, ectomy of infected valve, that is a native infected valve get removed and instead of that a prosthetic valve get placed. So repair and replacement of affected valve resembles the infected valve get cut or again replaced affected valve. So drainage of abscess and repair of heart tissues are done. This is all about infective endocarditis and you people have to know more about infective endocarditis, please refer the textbook of pathology Harsh Mohan. Thank you all.